Hello everybody and welcome to the Tuesday edition of Video Clips. And I have just a couple of announcements. First of all, summer semester at the Wellness Forum Institute starts in a month. So if you're going to take classes with us, you need to be getting the schedule and the course descriptions and figuring out what you're going to do. So, and the other thing is the Diet and Lifestyle Intervention course for healthcare practitioners, which is the class that Dr. McDougall and me and Dr. Moss and all the people that you want to learn from. It's teleconference, interactive. It's not web-based learning. You're on the phone with these guys. Well, anyway, that starts the same week. So if you're thinking that you're going to take classes from us this summer, now would be the great time to get with us. We do limit the enrollment for diet and lifestyle, so we don't want to turn people away, but we probably will based on our early enrollment. So anyway, let's get to something substantive here. I want to talk about some healthcare competence and integrity issues that I think are important today. And the first one involves dietitians, and the first thing I want to say is that I don't dislike dietitians. I'll probably say it again at the end just to make myself clear. We have dietitians who work with the Wellness Forum, teach for the Institute. I have good friends who are dietitians, well respected by me and my colleagues. So this isn't about individual dietitians who know what they're doing. It's about the institution of dietetics. And so you've heard me talk before about this conflict of interest with dietetics organizations taking money from industry. It happens all over the world, by the way, not just here in North America. Things are changing though because people find out about stuff now, so they can put pressure on groups to behave differently. And this just happened. The Flemish Professional Association of Food Experts and Dietitians, that's VBVD, I'll refer to it later by initials, has just apologized for its recent campaign announcing that sugar is part of a healthy diet, which was sponsored by Coca-Cola. The ad stated that sugar didn't need to be eliminated, but rather could be consumed in moderation. And this whole business about moderation, it's a meaningless recommendation. First of all, because moderation is so subjective. What it means to you may be different than what it means to me. And most people will interpret nebulous recommendations in the favor of eating things that they want to eat. But the biggest reason why healthcare organizations and dietetic organizations like to use it is it keeps the sponsors happy. It avoids the uncomfortable discussion about this food or that food is bad or good and good and bad dietary patterns. How did this apology happen? Well, Belgium's High Council for Health criticized VBVD, claiming that the ads undermined the independence of dietitians. Thank God I'm not the only one talking about it. And promoting the consumption of sugar. And again, people like to hear good news about their bad habits. That's a John McDougall quote that I use all the time. So people getting permission to eat bad foods from nutrition professionals is really attractive to some people. A board member from VBVD, and I would butcher it if I tried to tell you her name, so I won't, said that Coca-Cola did not have any say in the statements made in the ads, and the campaign was the result of an ad agency inquiry. She added that ad agencies frequently ask her organization to provide information for campaigns about macronutrients like protein and fat. She said that the group won't do it in the future, and the group's board members work as volunteers with good intentions. Well, you know, the road to hell is paved with good intentions. I've said that many times. The bottom line is that this group of dietitians and the rest of them won't acknowledge that if you're going to take money from these various manufacturers and ad groups and all the people that they take money from, you're going to compromise your message. And I think that dietitians would like to be respected as a group. And I think well-trained dietitians should be respected, but unless dietitians in this country start standing up and screaming and hollering about this, and in every other country, and demanding that their professional associations behave differently, we're going to continue to see this kind of horsing around going on, undermining the qualifications and independent nature of the advice we get from dietitians. Okay, so I picked on the dietitians, now let's pick on doctors. And this has to do with blood pressure, and I've been saying for many years we shouldn't be medicating high normal hypertensives. The evidence suggests that we shouldn't. Well, it's actually far worse than this, all right? According to the Centers for Disease Control, let's just start at the beginning, 67% of American adults have high blood pressure. That's 1 in 3 people. And we're now spending $45.7 billion a year in medical expenses to treat it. And of course that treatment is always, almost always with prescription drugs. Now here's the scary part. Doctors aren't sure how to treat hypertension. One would think that before we spend $47.5 billion on treatment expenses, docs would be fairly certain that they're doing the right thing, but that's not the case. According to several experts who spoke at the European Society of Hypertension meeting last year in 2012, the ideal number to which blood pressure should be lowered is unknown. Now, there were several people who spoke about this. In other words, this wasn't one rogue nutrition, or diet doctor that got up and said, well, I'm really not sure about this. This was numerous experts who spoke out and gave presentations on this very issue. One doctor said, and this is a quote, I'm going to read it to you, "And there is the big problem of the target for BP treatment that everybody has alluded to. Despite decades of trials, we are still uncertain as to what level we should lower BP to achieve maximal cardiovascular protection. And remember, we have absolutely no information on the BP value to be achieved when ambulatory or home BP is considered." End of quote. You know what he basically said? All that means, we have no clue. That should scare you a little bit. The docs at this conference advised that more trials are needed, particularly to look at people with high normal hypertension and whether or not they should be medicated if they have no other risk factors, to look at diabetics who might have high normal hypertension and see if there's any benefit from medicating them. Again, we don't know. And also how to address the J-curve, which shows that in certain populations, the more aggressively you lower blood pressure, the higher the death rate. Now, this seems like there's an awful lot of uncertainty while we're putting people on medication every day in this country. Ambulatory blood pressure monitoring was discussed, which is now formally recommended by the UK. And what this involves is measuring blood pressure periodically throughout a 24-hour period in order to detect fluctuations and to avoid medicating people, for example, with white coat syndrome, which one speaker said constituted 25% of the patients diagnosed with hypertension. In other words, 25% of the people who are being given a prescription just get nervous in the doctor's office, and that's why they walk out with blood pressure pills. But even the validity of this tool, it sounds like a better idea, probably anything's better than what they're doing, has not yet to be proven as a predictor for who should and should not be medicated. Hypertension, and here's the take-home point from this, it's a foodborne illness. It can be successfully addressed for most people with a low-fat plant-based diet, exercise, weight loss. And additionally, if any of you out there are taking blood pressure medication or your family members are, you ought to start eating the diet that we recommend right now and then get with a doctor to determine if you're one of the people who should even be on medication for hypertension. You might remember I talked about this when I was reviewing Gilbert Welch's books a couple years ago. He's written two of them, one about the cancer diagnosis and one called Overdiagnosed, where he talks about this very thing, that we're medicating people with abnormalities that are clinically insignificant. And fortunately, this is only good news in this whole mess here, this group of cardiologists are basically saying, we don't know what we're doing. Now, this should be on the cover of the New York Times, in my opinion. Cardiologists do not know what they're doing when it comes to blood pressure medication. I'm sure it's not, but at least I'll tell you, and hopefully you can tell others, and we'll spread the word. Well, that's all for now. Have a wonderful day, and I'll be back to you on Thursday. As always, feel free to pass this on to anybody who you think would be interested in watching it. Have a great day.